Welcome back. I'm Monty. This is Tristan. We're going to go over a little bit more on the lateral epicondylitis, or commonly known as tennis elbow. If you look at one of our prior videos, we discussed taping techniques for it. So what I want to do today is go over some treatment techniques that you can do just for yourself to help with that lateral epicondylitis. It's a real bugger when you get it. It hurts pretty much anytime you use these muscles right here. I'll show you where lateral epicondyle is, this little bony prominence right here. So if I can circle that with this right here. Oh, look at that. That works much better. So that's the lateral epicondyle. All these muscles, right? I'm not going to draw all over his arm. So all these muscles that come from his wrist to his fingers come up and attach right here. It's called the common extensor tendon. Come right up to that. And what happens is you get some inflammation on that bone where they all attach. So you can do your own treatment of a cross-friction massage to help reduce the pain on that. And basically, if you just take your other hand, go across right below that bony prominence over those tendons, back and forth and back and forth. You know, I used to do it to myself when I had that. And if you do that for a few seconds, maybe up to 30 seconds, the pain goes away. Okay? It helps increase the blood flow to that area and reduce the pain. The other thing you can do is to help strengthen or mobilize that tendon and tissues with some resistance training. The resistance training that we can do, you can use a band or you can use some weights. I'll show you both. What you can do is take the band, and you want to do what's called eccentric training. Basically what that is you raise the resistance band up without resistance on it, you add some resistance, and you slowly bring it down against gravity. Now bring it back up, add the resistance, slowly bring it down, okay? What we're trying to work on is these muscles right here. If we just did a typical strengthening exercise where you had it like this and you pull it up and pull it up and pull against resistance, that just hurts more. It just causes more irritation, more inflammation. So you can also take the dumbbell and you have to assist it up, okay, and then slowly lower it down through the full range of motion to really get this muscle right here all the way down. And then bring it up and then slowly bring it down. Up. And you can do that maybe 10 times, okay? You want to avoid any pain, any increased pain to that area, and you just repeat that. Studies have shown that doing it that way will help improve the endurance and strength of this muscle faster than any other training technique. Prior to that, you also want to stretch these muscles out, these tendons. So you can do that two ways. I found that most people get the stretch if they can do it like this, but also extending their elbow out like that. So go ahead and try that, Tristan. So take your hand, bring it here, and straighten it out. Now you can really get a better stretch if you turn that down like that, all right? And it puts more of us right in line there. And you can also kind of play with it and see which angle feels more of a stretch on these tendons. And that takes the strain off of that as well. The other thing that I like to do to help reduce inflammation is take some ice. You can also oftentimes take a Dixie cup or a styrofoam cup, fill it with some water, freeze that for a while. Take that. The reason the cup is there is so you don't freeze your other fingers when you're holding it. And you take it, you just rub it right along there. Okay, just circulate it back and forth, rub that. It usually takes about 5 minutes. That's nice and red and it's fairly numb to the touch. And you can get rid of that cup. So that's a quick way to help give an analgesic effect or a numbing effect to help with the pain and reduce inflammation to that as well. With that, there's the common treatments for tennis elbow or lateral epicondylitis. Hope it goes well and you get pain-free fast. Thanks.